I do think it needs more awareness, especially in the UP. It's not talked about a lot, even out of the UP, but especially in the UP.
Hannah Chase has been living with purging anorexia, a kind of eating disorder, for many years. When looking for treatment at a young age in the UP, it was nearly obsolete. Hannah eventually went to a psychiatric hospital in Grand Rapids because it was the closest service at the time, this of which was not ideal.
I was there for like 2.5 weeks, and then once my weight hit a certain level, they just booted me out pretty much. So it was more just like a force feeding program rather than like therapy, really.
Since this time, Hannah sought other treatment options in other states. Although she has received these services, the disorder is still a daily struggle. Much like other addictions, when living with an eating disorder, it is easy to get stuck in a cycle.
With like alcohol use or drug use, you can stop doing that. You can stop drinking alcohol, or you can stop doing illegal drugs. But with food as an addiction, you have to eat. And so we constantly have to manage our eating habits. And so I don't know that there's actually a total cure, but it gets better.
When treating an eating disorder, there are a number of different approaches that can be taken, such as visiting a nutritionist, specific medications, and therapy, just to name a few.
A lot of it has to do with self-image, so a lot of people need to have their self-image, their self-esteem worked on and improved as well. And when your self-esteem is improved, when you feel better about yourself, then you'll feel better, then you'll eat better. So it's kind of a combination of things.
Despite the millions of individuals impacted by this addiction, the Upper Peninsula has no inpatient treatment for eating disorders. When Hannah attended school in Marquette, she felt alone for the lack of help from her teachers and faculty.
No one at school, like no teachers. I mean, it was pretty obvious I was struggling, but no one reached out.
Since living with an eating disorder, Hannah is working to become a counselor. Although having an eating disorder can be an endless struggle, looking at her achievements and raising awareness has helped Hannah feel fulfilled.
I think it's just an everyday struggle, but it's also, I don't know, it's just like I'm also everyday winning at, here I am, I'm still alive, and now I have a son, and now I'm getting my master's degree, so it's like I'm proving to myself that I can do it. Yeah. But I want other people to know that they're not alone, especially in Marquette.
If you know someone who is living with an eating disorder, listening and being a good friend can go a long way. Helping them seek medical treatment or therapy is highly encouraged.